Started. So hi, everyone. Welcome to CalAIM Links Fresno session number 2, Preparing to Contract. My name is Melissa Meza, and I'll be one of your facilitators today alongside Alexis Taylor. I am a senior program manager at HealthBegins, and at HealthBegins, we are a national mission-driven consulting and training firm. And it's our goal to help healthcare and community partners improve the social and structural drivers of health equity for patients and communities. Slide. Before diving into introductions, we'd like to take a moment to thank you all for joining us today. We'll have a very dynamic session that prioritizes information sharing, and we are really excited to have you here with us today. Smile, everybody. We are recording. We'd like to let everyone know that this session is going to be recorded and available after the session has been completed. Most importantly, we'd like to extend a special thank you to our project partners. CalAIM Links is a collaboration of Transform Health, Aurrera Health, and HealthBegins, and we are being generously funded by the California Healthcare Foundation. To learn more about any of our partners, links have been included in the presentation materials that will redirect you to their company site. As mentioned, our work is funded by the California Healthcare Foundation. We'd like to extend a very special thank you to Carlina Hansen from the California Healthcare Foundation, who has invested an incredible amount of knowledge and resources to make this work possible. As we dive into this session, we'd like to set the tone by providing you with a summary of the learning need we've heard so far, mainly to ensure that our learning sessions are reflective of your needs. I'd like to share what we've heard back from our participants. Through conversations, readiness assessments, polls, and surveys, we've learned that CBOs are experiencing contracting gaps with reporting requirements, referrals processes, braiding and blending funding, certification applications, data sharing.
Yay! Dang, that took forever, huh?
And if everyone could.
I'm so tired. That's the wrong. You guys are going in through there?
Okay, so other things that we've heard through conversations with the plans are feedback for provider interest forms, certification applications, reporting requirements, and gap filling. To date, we've covered a majority of these topics, and today we'll cover a few more. As mentioned at the top of this session, this is the second session of a 3-part series that focuses on how to become a community supports provider. Just to provide a little bit of context for today, session 1 focused on contracting pathways, standard terms and conditions, and certification processes. Today's session 2 focuses on understanding financial and reporting requirements. And our final session, which is being held on December 7th, will focus and incorporate those lessons and the feedback we've received into best practices. If you want to access the materials for the previous sessions, including this session, the decks are hyperlinked in today's presentation, and the recordings are available on the CalAIM Links microsite. Once again, the website is healthbegins.org/CalAIM, and that link will also be dropped in the chat for everybody. That being said, and building upon what we have learned over the past year, by the end of this session, we hope that participants will be able to 1, understand the impact of community support services, 2, identify key documents to support navigating the contracting process, understand elements of each health plan certification application, name CalAIM funding opportunities that can help CBOs build capacity, identify billing and claims and data sharing requirements for becoming a community supports provider. And finally, we want everyone to get the opportunity to know each other and the plan representatives on the call even better. I'll go ahead and cover our agenda really quickly. And so in order to accomplish our objectives, this agenda includes a series of introductions, going over why community supports matter, talking about certification, having a short Q&A part 1, discussing funding opportunities, Q&A part 2, claims and billing, including minimum data elements and HCPCs, as well as bonus material, which includes going over referrals. And then we'll close out with a Q&A part 3 and important contracting and implementation documents. Based on the objectives entailed, we assume that today's attendees are CBOs located in the Fresno area. You are interested in direct or indirect contracting with Anthem or HealthNet to provide community support services. You have an intermediate understanding of CalAIM. If you don't worry, we have a volume of foundational information on our website that will get you up to speed. And lastly, you have completed a CBO readiness assessment to let us know how prepared you are to fulfill a contract with an MCP. Now that we understand the goals for our session today, we'd love to get to know one another a little bit better. Relationship building is a key component. Next slide. Thank you. Relationship building is a key component of becoming a community supports provider. We'd like to remind everyone that we are amongst friends. This is a safe space and we are highly experienced in providing important services. So we want to strongly encourage communication between attendees and the facilitators, but we also between participants. To set the tone, first, we'd like to ask everyone to update their Zoom name and add their preferred pronouns. So please go ahead and update your Zoom names, include your pronouns and your organizational affiliation if you'd like to. We encourage you to use the chat throughout this webinar, and we'll kick things off with sharing our names and organizations in the chat, along with any emoji that represents how you feel. And to break the ice, we'll conduct a rapid round of intros. Please share your responses to the following 2 questions. So the first is, how do you hope community supports will advance the work you do? And what do you hope to get out of today's presentation? Alexis is going in and dropping some of those questions for us. So if you can go ahead and type those in the chat. And
how'd you throw that piece of concrete off?
I will also call on, do we have anyone from Anthem or HealthNet on the call?
It doesn't look like they're on the call just yet, Melissa.
Okay. Are there any participants who want to go ahead and unmute, introduce themselves, and answer the question for us? How about Shelly Oz?
And Melissa, I also see that we just received a chat from Carol and Giovanna. And so, yeah, if either of you all want to unmute briefly, just to let us know what you're looking forward to receiving out of today's session, that would be wonderful. Just as Melissa mentioned earlier, we want to make sure that today's content is tailored to specifically what your needs are. And so, yeah, we would love to make sure that we're fostering some bi-directional conversation. But yeah, just getting to know each other at the top of the call.
Oh, that's okay, Carol. How about Giovanna and Maria?
Hi everyone, Maria, you want to say hi? Hello. Yeah, so here we are together. Sorry about not having a webcam, but at least I think our microphone works. And like we mentioned in the chat, you know, we just hope to learn anything and everything. You know, we're still relatively new to this, so we are sponges here. So thank you guys.
Awesome. Can I just ask a quick question? And Shiva, do you mind hopping back to the slide where we outlined the agenda? A couple slides back. And just a quick question to everyone. You can also use the chat. Do any of the topics in here stand out to any of you, or are more of a priority for you to hear about?
For us, it would be claims and billing.
Awesome. Thank you for sharing that.
Hi, this is Shelley from Fresno County Public Health. Sorry, I heard my name earlier. I was trying to create a Google workspace while I was listening so I could download some documents. Sorry about that. But my particular interest, I think, today is contracting, the process and timeline around that.
Awesome. Thank you so much. So I think we can go ahead and move forward. Does that sound good, Alexis?
Yeah, definitely.
Perfect. So we can jump back to MCP contacts. So as you previously heard, we will be having our plan partners on today's call. That includes Brandy Jenkins of Anthem and Leslie Bordeaux of HealthNet. Hopefully they will join us a little bit later during the session. They are here as champions of your learning needs and will be available for questions throughout the session. You may also use the chat to go ahead and communicate questions as well. You can send those to myself or Alexis Taylor.
And we have Brandy available now to do a really quick intro, Melissa. Hey, Brandy, thank you so much for joining us today.
Hi, sorry, I was having technical difficulties. My name is Brandy Jenkins. I'm Regional Program Manager here with Anthem Blue Cross. Thank you.
Thank you so much. Okay, so before we move forward, we are going to go into a poll. For this poll, we are looking to understand where you are in the contracting process with your health plans. So if we could go ahead and launch that poll. And these polls will help us determine your needs for the day and whether we need to prioritize specific sections, as I mentioned. And we'll go ahead and leave this until we have about 40 to 50% participation. So if everyone can just go in and select their contracting stage. Okay, I think we can close that out. And then share the results, please. Thank you. Okay, so it looks like about 30% of you are beginning to think about it. 20% have had initial conversations. 20% are in the contracting process, and 30 are in the signing contract process. So kind of a mixed group here. So we will try to meet all of your needs today. The next poll that we have, if we can move on to the next one, is mainly to determine which types of community support services your CBO has experience providing. So this one is multiple choice, I believe. So if you can go in and select the ones that you are providing. And again, we'll try and get to about 50%, and then we can close out the poll. Okay, I think we are okay to close it. And for this one, it looks like 63% are providing housing transition navigation services, housing deposits or housing tenancy and sustaining services, sobering centers, recuperative care, and home-based services. Awesome, thank you so much for sharing. Okay, so before diving into the certification applications, we want to provide a brief recap of what community supports are and why they are so critically important. I'm going to touch on this very quickly just because we want to spend a little more time on what you all mentioned was important for you today. So as a brief recap, community supports are medically appropriate, cost-effective services that managed care plans can offer in lieu of traditional Medi-Cal benefits. This means that they are not combined with Medi-Cal benefits. They are provided as an alternative to Medi-Cal benefits. They are optional for a managed care plan to provide and for the member to accept. This is not a requirement. They build upon the equitable learnings from the whole person care pilot. And most importantly, managed care plans are highly encouraged to contract with CBOs, who we have present here, as you've seen, to provide community support services. So where do you fit in as an organization? Community supports providers are organizations with expertise in the community and in the specific support they are contracted to offer. A lot of you on the call here today are already experts in providing these services, but now you can get paid through the state to provide them. Community supports are an amazing opportunity for local providers to provide Medi-Cal beneficiaries with services that have not previously been accessible through Medi-Cal and that address their social determinants of health. Your role as a community supports provider is threefold. So that includes contracting, delivering, and meeting. What does that mean? Contracting includes community supports providers working with managed care plans and becoming a part of their network of providers, in many cases expanding the network to CBOs who previously have not played a role in Medi-Cal. Also, this includes delivering critical medical and social services such as housing navigation, recuperative care, medically tailored meals, or community transitions, which are not typically funded by Medi-Cal. And finally, your role as a community supports provider is to meet contracting and reporting requirements, such as those related to care models, billing, and data sharing outcomes tracking, which Alexis, our project manager who's on the call today, will touch on later and during session 3. There are a ton of entities that can be community supports providers. These include a few of the ones listed here. So vocational services agencies, supportive housing providers, county agencies, providers of services for individuals experiencing homelessness, and social services agencies, and some that I have not touched on today. I once again want to reemphasize that these organizations, including yourselves, are already experts in providing community support services. Community support services are outlined here. So DHCS has actually pre-approved 14 community supports that managed care plans may offer. These include housing and tenancy supports, recuperative care and respite services, nursing transition services, supportive food programs, and home modification services. Detailed descriptions of these services, including eligibility and service limitations, can be found on the DHCS Community Supports Policy Guide on the DHCS ECM ILOS website, which those links will also be dropped in the chat for everyone to access. So why does all of this matter? Community supports matter because of the goal of CalAIM is to address not only health needs, but health-related needs. This means we are addressing social determinants of health by addressing the needs of the whole person. Under CalAIM's population health management approach, managed care plans will implement strategies to health-related social needs that focus on wellness and prevention. CalAIM also uses a whole person approach to address both medical and social determinants of health needs, as I've mentioned earlier. This serves to improve quality outcomes and reduce health disparities. We do have a little bit of data here that we'd like to share. So because of community supports, we've seen a 27% reduction in inpatient psychiatric admissions for housed individuals. We've also seen improved quality of life, reduced substance use, and improved physical and mental health. And finally, data reveals the annual rate of emergency department visits is 75% lower among housed individuals compared to unhoused individuals. All in all, we can see that community supports have a positive impact on the community and really benefit those who are taking advantage of them. So we have one more poll before we move on to certification applications. So if we can go ahead and also post this one. And we'll give it until we get up to about 50%. So if you can please list the historically marginalized populations that you've worked with in the past year. Okay, we'll give it 10 more seconds. Okay, let's close that poll. All right, so it looks like we have the majority working with Medi-Cal eligible children and adults, people with limited English proficiency, and individuals experiencing homelessness. Thank you so much. So as I mentioned, we'll be moving on to certification applications. So I'll go ahead and hand it over to my colleague, Alexis Taylor.
Thank you so incredibly much, Melissa. I really appreciate it. Hi, everyone. My name is Alexis Taylor. Some of you have seen me in prior sessions, both statewide and county-specific sessions that we've been hosting over the past year for CalAIM. And so I just really wanted to re-emphasize for everyone that One of the main reasons why we wanted to make sure that we were providing some impact data on community supports before actually diving into the contracting process was to just really validate just how important these services are, not only for your patient populations and the members that, you service on a regular basis, the ones that you have an expertise in providing critical services for, but, just really realize and explain how when we have multiple providers that have been provided with the resources to render an expansion of services, it has a tremendous impact. So some of the data that we were able to talk through earlier is data that has been pulled from, around the country when other similar services were executed in lieu of providing, traditional services. We've seen those outcomes really improve health outcomes at multiple levels. So we really wanted to do some level setting by starting off with all of that amazing information that Melissa shared about what community services are, our goal in trying to make sure that you secure those contracts so that way you can provide these services and what the actual impact is at a greater level. So diving into the meat of today's conversation, we're going to walk everyone through the certification process. And before we do that, we really wanted to talk to you about some very important documents that I'm going to be referencing for the rest of today's session. So I just wanted to get everyone oriented to exactly what I'll be discussing so that way you can be well aware of it as I start to call out those names so it doesn't feel like it's like foreign terminology. So we have dropped in the chat for everyone a link to today's presentation. And so if you're able to download that presentation, you'll be able to join us on slide 25, where it has important documents. You'll be able to click on any one of those documents that's presented in this slide, with the exception of the first one, model of care. And you'll be able to follow along with me as I just provide some explanations as to what these documents are. So that way, as we progress, you'll know exactly how those documents are being referenced. So as Melissa outlined, this is the second of 3 sessions that we're hosting for this specific cohort. As we outlined in the first session, in order for you to become a community supports provider, you have to meet the DHCS and the plan requirements. So before even initiating the contracting process or approaching the plan about initiating the process, your organization should first review these documents. So the first one is going to be the model of care. The model of care is what DHCS requires the plans to have in order for them to outline how they're going to provide community support services. And that model of care is important because it also talks about how they're going to engage with providers, i.e. yourselves, and what your role in being able to provide those services are. So that's one important document for you to review. You would be able to receive that document directly from the plans. The next document that we're going to be referencing is probably one of the most important. It's going to be the standard terms and conditions. As we covered in the first session, the standard terms and conditions are the core requirements that a provider must meet in order for them to contract with an MCP. Those standard terms and conditions are going to outline some requirements around how you deliver your services, the quality of your services, the data that you have to share, and payment considerations. So DHCS did a really good job in making sure that you had like a complete arsenal of what the expectations are, so that way you would have that information before going into the contracting process. Next, we're going to be referencing the Community Supports Policy Guide. Later on, when I'm discussing the contracting process, you're going to hear me reference service definitions. So essentially right now, all of your organizations provide these services. However, DHCS has outlined very specific community supports service definitions. So when you are submitting your certification application, you just want to make sure that you're using the language from that policy guide that, has those service definitions, just to make sure that you're using the right terms and that your services actually are in alignment with what DHCS is requiring. One of the ways I always like to break this down is if you are submitting a job application to become a chef, you really don't want to submit a resume that is, one for an engineer, and vice versa. So essentially, when you are submitting that application, they have given you the very specific language that you need to use to make sure that you're listing out those definitions properly. Next, we're going to reference the non-binding pricing guidance. This is also another very important document. It just provides recommendations for negotiations. So when the plans and the provider comes together, they're going through the contracting process. Oh, what rates, do we need to charge for our services? This non-binding pricing guidance really provides you with a lot of considerations that you should, just assess when you're determining what those rates should be. So that's for the provider and the plan to use as guidance for those rates. Most importantly, it is non-binding pricing guidance, meaning that it is not a standardization. You can negotiate those rates with the plans and the providers. And then lastly, we are going to discuss billing and invoicing guidance and HCPCS codes. So this is just like the minimum data elements and just the information that you need to include in your invoices when you are submitting for claims, just like the codes that you need to include on those. And then lastly, we're not going to get into this too much today, the quarterly implementation report. I'll just, touch base on, just the quarterly requirements that those providers are going to have. So that way, every, at 3 months approximately, when the plan comes to you to render a report, that you'll already, expect what you need to have put together. So I really wanted to take some time just to break down those documents and make sure that everyone had access to them, because if you're looking at them for the first time, they can feel like, oh, wow, like this is really overwhelming. But once you're able to hear them in this context and really just break them down, demystify them, it's like, oh, okay, as I look at them with that context, I know exactly what it is that I'm looking at. So if we go to the next slide, I would like to dive into the contracting process, what everyone is here, for today, the bread and butter. So the overview of the contracting process, if you are a community supports provider and you want to secure a contract with an MCP, you are going to do 4 things. The first thing you're going to do is submit a letter of interest. In this slide deck, we have really just tried to make this as easy as possible for everyone. We've already included the letter of interest for both HealthMed and Anthem. We'll dive deeper into that form in just a few minutes. It's a really basic form, and I'll explain exactly what it's going to request of you so you'll know what to have ready. And something that's very important about that letter of interest, you are going to need an NPI, which is a national provider identifier. I've also included a link to that application for you. Super easy to submit. It's a number that comes directly from CMS to just give you an identification number, almost like a driver's license, just to be able to identify you as a provider. So, once you go ahead and fill out that LOI, make sure you go online to request that NPI so that NPI can be on that letter of interest, and then you'll submit that to the plan. So that way they know that you're interested in becoming a community supports provider. And so we'll also make sure to drop those links in the chat for you if you just want to take a look at those websites right now. Like I said, super straightforward process, very easy to go ahead and apply for that NPI. So after you have submitted that letter of interest, plan is going to connect with you based on the information that you provided in that letter of interest to work with you to fulfill the certification process. In just a moment, we'll show you exactly what those applications look like. And right now I'm going to talk you through what you need to do, when you're submitting that certification. So the most important thing for the provider to do when you're completing that certification is to validate your experience. The plans and DHCS want to make sure that the community supports providers they are contracting are experienced in providing the services that, they want to pay you for. So that's going to be really really important as you're drafting out that narrative. Is going to be validating your expertise in providing the community supports that you were saying you want to provide. Going back to that document I was just referencing, the standard terms and conditions, you need to make sure that as you're submitting that application, you are validating that you can meet those requirements. There's going to be workforce requirements, service delivery requirements, data sharing requirements, and we have listed all of those requirements for you in the first session. So that way, if you want to get a very comprehensive understanding of what those requirements are, we've included a link in this deck. So that way you would be able to go back and watch that first session as to what those requirements are. As I mentioned previously, you also want to make sure that when you're writing that narrative, that you want to use the service definitions from the policy guide. As you can see, we've hyperlinked that policy guide for you right there. Like I said, nice and easy for you. So that way, as you're writing down exactly what your community support services are, that you're just using the language that DHCS has actually outlined in that policy guide. And then most importantly, about the actual sections of that application that you're going to complete, you're going to complete the provider information section, the general provider section, and the sections for the community supports that you want to provide. We have received questions in the past stating, do you have to fill out the community support sections for the entire document? Absolutely not. You only need to complete the community support sections for the services that you want to provide. So the other subsequent sections, you can go ahead and leave blank. Just focus on, making sure that you're drafting out that narrative to validate your experience. Make sure that you're using language that's reflective of those service definitions, making sure that you're saying that you can meet the capabilities as outlined by those standard terms and conditions. And then after you have done all of that, you'll submit that certification application to the plan. They're going to assess that application to see where there are gaps, because they understand you may not have a 1000% comprehensive understanding of what those standard terms and conditions are and what your requirements are. So they're going to work with you to put you through the gap filling process, so that way they can say, hey, we've identified a gap here, maybe with your billing systems or with your staffing plan or with your IT infrastructure. So they're going to say, hey, these are some areas that we need like some more clarification on. We need you to do this, take care of that. So as you work through that gap filling process and you meet those requirements, that's what's going to move you forward to the contracting process. Once you actually reach contracting, you're going to negotiate with the plan and justify your rate. Going back to that non-binding pricing guide that I was just discussing, it gives you so many considerations that the provider and the plan need to consider when they're talking through those rates. I'm going to dive deeper into that later, but just to give you a taste of that information, they're going to ask you, or it's going to, recommend that you consider, the location of the services, the size of the staff, the size of the facility that you're using, so on and so forth. So that way, when you enter contracting, you have a really good understanding of how to negotiate. So just to give you a quick overview of the contracting process, first, you're going to submit that letter of interest, and get an MPI that you're going to put on that letter of interest. Next, you'll move forward completing that certification application. You'll make sure that your narrative validates your experience, that you're explaining exactly how you can meet the standard terms and conditions. You're going to make sure that the service definitions are in alignment with the policy guide. You're going to complete the general provider information section, the general provider section, and sections for the community supports that you want to provide. Then you'll go through gap filling, where you're going to, fill those gaps wherever you have voids, and then you'll go into negotiations and contracting. So that's a very high level overview of the contracting process. Something that was really important that we wanted to make sure that we shared with you is that if you are in Fresno County, or actually in a couple of counties where Anthem and HealthNet are present, and you want to work with both of those MCPs, they have worked together so that way you only have to submit one certification for both of the plans. So if you are able to go through certification and gap filling and contracting with Anthem, for example, you will be able to use that same certification application to, move forward with contracting with HealthNet as well, because it's all the same information that they're collecting, and they do want to reduce the burden on the providers themselves. Two other very important things I wanted to reference was that for the certification itself, you can use IPP funds, and I'll dive into exactly what that is. You can use IPP funds to support completing that certification application and the gap filling process. So DHCS essentially realized that providers were going to need support with navigating this process. So there are a lot of funds that are available to help you get through that. And then lastly, I wanted to let you know that another pot of money under PATH, which is the cited program, is something that you can use to build the capacity that you need, not only for contracting, but implementation as well. And so I know that was a lot to process in that one moment, but I'm going to deconstruct all of this for you. This is just an overview. So if we go to the next slide, I just wanted to recap each plan's process. So for HealthNet, as we stated previously, you're going to obtain your MPI by clicking the link that we have in that deck for you. You're going to submit that letter of interest. And then they'll reach out to you to walk you through the certification application. And as a part of that, they'll collect your W-9s, your COIs, your certificates of insurance, your claims and referrals abilities, so on and so forth, so that way they can put you through the gap filling process. And if we go to the next slide, I just wanted everyone to see exactly what that interest form looks like. So this is a screenshot of the actual form itself. It's very simple. You're going to let the plan know which counties that you're interested in contracting for community supports, the types of services that you want to offer, your expertise, your capacity. Your capacity is really important because they don't want to refer more members to you than what your organization can take on. So that's really important, to just let them know exactly what your capacity is so that way they could work with you. You're also going to talk about your capacity limitations or any other information that you would want to share with them regarding those services. And if we go to the next slide, here's an actual screenshot of what the certification application looks like. Just as I mentioned previously, you need to complete that provider information section, the general provider section, and the sections for any community supports that your organization is ready to offer. I cannot stress enough that the most important thing about drafting out this narrative is to make sure that you are drafting it in alignment with the standard terms and conditions, that you are drafting it in accordance with the service definitions, and that you are validating your experience, because the members themselves that are going to receive those services the state needs to ensure that they're receiving those services from the most qualified organizations, which is, fantastic. We're just making sure that those organizations are up to the task to be able to provide those services. And so moving on to the next slide, I wanted to walk you through essentially something very comparable. Now it's the Anthem certification process. So as we mentioned, you're going to get your NPI and submit that letter of interest. We've included the link there for you. You're going to go through the certification process. You'll go through the gap filling process, and then you'll enter negotiations and contracting, just as we mentioned. If we go to the next slide, here's a screenshot of what the Anthem letter of interest form looks like, asking for very similar information just about your organization, the counties, the types of services, your target population, and the services that you currently offer. And then moving on to the next slide, we can see a copy of what their certification application looks like. And like we said, you do not have to complete this application for both of the providers. It's completely up to you. The plans really wanted to work together to make sure that they're being as helpful as possible by giving you the option to submit one of those applications for both of those plans. And so right here, we're going to pause for some questions. And so the key takeaways that we have are that community supports are medically appropriate, cost-effective services that MCPs can offer in lieu of traditional Medi-Cal benefits. The contracting process consists of obtaining an NPI, submitting that letter of interest, completing a certification, undergoing gap filling, and then finalizing that contract. Providers have access to a host of documents to help you navigate that process. Like I said, DHCS wanted to make sure that you were not left alone by making sure they rendered an entire library of resources to support you. And then lastly, when you're submitting that application, you just need to ensure that you are validating your experience, your ability to meet those standard terms and conditions, and applying the service definitions on that application. So just to recap, for part one of this webinar, if we go to the next slide, we covered a very brief refresher of community supports and why they matter. We overviewed the contracting process, including certification, gap filling, and contracting. And in the next sections, we'll discuss funding opportunities to build your capacity, claims, billing, and referrals. And so we'll just pause right here to see if anyone has questions.
Alexis, there is a question from Valerie. If we submitted an LOI to one provider, can we send an LOI to the second provider at a later time?
Yes, you can submit the LOIs whenever your organization is ready to submit that LOI. So, once you submit that, it means that you have gone ahead and received your NPI, you reviewed the standard terms and conditions, you reviewed the service definitions, you've reviewed the service delivery requirements, and you're like, hey, we are ready to go through this process. So if you started that process, for example, with Anthem, and you want to start that with, the other plan down the line, you totally can. That's completely fine. And everyone can feel more than free to unmute and jump in with any questions. Oh, of course, Valerie, no problem. So everyone can feel more than free to unmute themselves to ask questions or dive into the chat. And I'll just wait a few seconds to see if there's anything else before going on to what I think is going to be everyone's favorite section, funding opportunities and then claims and billing. But yeah, I'll wait a few seconds to see if we have any other questions.
I have a quick question.
Thank you.
So we're currently contracted with HealthNet. So what would it look?
Oh, I'm so sorry. It cut out, so I wasn't able to hear the question. I'm so sorry about that.
Sure, no worries. Can you hear me?
Yes, I totally can now.
So we're currently contracted HealthNet. So how would that look like?
Sorry, Giovanna Maria, it went out again, but I'm assuming that the question is if you're currently contracted with HealthNet, what would that process look like to now contract with Anthem? And I think that we lost them. Oh no. Okay, maybe they had some tech issues and we'll jump right back on. Hopefully so. We are available to answer any other questions. So does anyone else have any questions that they wanted to ask before we go into funding opportunities, claims, and billing? All right, Melissa, can you flag for me when they hop back on so I can make sure I get that question?
Yeah, I can do that.
Awesome, perfect. So let's dive into funding opportunities.
Alexis, they just hopped back in.
Oh, there we go. So sorry, Giovanna, we lost earlier.
I'm so sorry about that. I guess one of our AT&T guys are messing with the internet right now. So
No
sorry.
problem.
So the question was, if I can remember the question, is okay, so we're currently contracted with HealthNet. So how would it look like? Should we also be contracted with Anthem? Like, would it be like if our capacity right now is 50 and we also request to be contracted with Anthem, would that mean that it'll be like 100, just as an example? Like, would it just be double?
So Brandy, I would love to hear your feedback on this, but I'll try to take the first pass. It's my understanding that your capacity would not just be doubled because you would be contracted with another agency. It's my understanding that you would still need to explain your capacity so that if your total capacity is 50, that's your total capacity. But if you currently have the capacity to serve 100 and you're only serving 50, then you would be able to increase that capacity. But I would really love to hear Brandy's feedback on that response. Oh, Brandy, so sorry, we can't hear you. I see that you unmuted, but we can't hear you. No, we can't. Brandy, you can feel more than free to use the chat as well. And what I can do is do a voiceover. We live in the age of tech issues. So we appreciate everyone bearing with us, of course. So as soon as, okay, so that response was correct. So it's your overall capacity. So if you are contracted with one plan, 450, and that is your total capacity, then that would be your total capacity across plans. But if your total capacity is 100, then and you're only fulfilling 50 of that, you would be able to up your capacity to 100 by utilizing that other plan. And it says if they want to contract with Anthem, we can use HealthNet's application that was submitted to them. Once again, going back to reducing that administrative burden for you all. So that way you would not have to go through that entire certification application process again.
Thank you so much. And where would we, I'm looking at Brandy's chat. If they want to contract with Anthem, we can use HealthNet's application that was submitted to them. We just need our specific Anthem LOI. Okay, and then that was my question. Okay, that's where we go. Okay, thank you guys so much.
No problem. Super happy for the question. And so, yes, so that's how you would initiate that process. You would go ahead and submit that LOI. And if I'm not mistaken, I'm not sure if there's another manager that is the person that is the recipient of that. But if not, you would essentially be put in contact with Brandy's team, and they would support you through that process. All right. Moving on to funding opportunities and then claims and billing, I wanted to back up to explain to everyone exactly what I was referencing earlier about those programs that are available for you to tap into, so that way you can navigate this process. So if we go to the next slide, the funding opportunities that we're going to discuss today are PATH and IPP. So now that we've discussed the contracting process in full, a lot of providers really want to know, okay, what resources are there available to help me build the capacity that I need to secure and implement this contract? Not just implement the contract, but to secure and implement this contract. So because DHCS understands that MCPs and providers, they're going to need to make investments in their care management capabilities, infrastructure, IT, data exchange, workforce, so on and so forth. There are two major funding programs that have been designed to help y'all get through exactly this. So the first of those major initiatives is going to be PATH, which is providing access and transforming health. This is a 5-year, $1.8 billion initiative, not million, $1 billion initiative to help CBOs build up the capacity and the infrastructure that they need to provide those community supports services. So just as we mentioned, we'll get into the data sharing requirements, the minimum data elements, how claims and referrals are received, so on and so forth. We'll get into that later, but they understand you might not already have those systems in place. So these are funds to help you get those systems in place so that way you can be ready to become a community supports provider. The second pot of money is going to be IPP. This is the Incentive Payment Program. And this program serves to increase participation in CalAIM. As Melissa mentioned earlier, CalAIM is not required of the plans. Community supports is not a requirement of the plans to provide. So in order to promote and foster that participation, the plans are incentivized by receiving this incentive payment program that they could then use to help you become providers. Funding for that specific program is going to go all the way through 2024. And over the next couple of slides, I'm going to break down exactly what that means. This is just the overview. I'll break that down precisely for you all. All right, so moving to the next slide. IPP, I know this is bad practice, but I'm just going to do it because I really want you to understand this overview comprehensively. So IPP funds are dispersed directly to the MCPs for them to support the implementation of ECM and community supports. So the MCPs are the holders of those funds. And what they can then do is invest in networks development, infrastructure, i.e., helping you build up those systems, helping you navigate that contracting process, that certification process, and the IPP funds that they are using essentially have been identified as funds that can be used to fill gaps. For example, one of the gaps has been recognized to be helping CBOs navigate this contracting process. So essentially the state is trying to be very thoughtful about what your needs are and is creating funds to make sure that you can, secure that contract. So that's the overview of IPP. Now, what can it be used for? In addition to helping you navigate the certification process, just like I mentioned, it can be used to help you build capacity, develop IT infrastructure. It can be used to reduce health disparities, to improve quality. And like I said, most important, to incentivize participation in this CalAIM initiative, to incentivize participation in community supports. So this is just one of those funding streams. Additional funds are going to be available in Q1 of 2023. That is literally right around the corner. So if you are an interested provider that really wants to have some support navigating this contracting process and building the capacity and infrastructure for those systems that you need to meet the standard terms and conditions, go ahead and connect with the plan directly. They will let you know exactly how you can apply for those IPP funds to help get you through this process. And don't forget, most importantly, as you're navigating this process, the most important thing for you to do is validate your experience. That is super important. Obviously, these funds are not just going to be given out. There is, just a validation that needs to occur to make sure that you are a well-fitted provider. So if we go to the next slide, the next thing I wanted to talk to everyone about was that next set of funding. So that's going to be the PATH program. So there are 4 major initiatives under the PATH program. Everyone already has a copy of the deck. We've dropped it in the chat a few times. We'll make sure to drop it in there again. But if you walk through this slide with us, which is slide 38, you'll be able to click on any one of those squares, and it'll take you directly to the funding initiative that we're discussing today. So the most important for us today is to discuss the cited initiative. So I always joke about this because this is such a long term. It is the Capacity and Infrastructure Transition, Expansion, and Development Initiative. That stands for cited. Say that 5 times fast. This program is intended to support the transition, expansion, and development of ECM and community supports services. So what does that mean? You right now, in your capacity as a provider, are already providing these services. But in order to take advantage of CalAIM, you will have to go through some changes, right? In your billing systems, your workforce, your hiring, so on and so forth. So cited funds are to quite literally help you with transitioning to being ready to provide those services and to expand your services on top of that. So that's wonderful. A few things that you can use those funds for are upfront funds to build capacity, to improve your IT infrastructure, to hire workforce, to work to support your evaluation and monitoring, to conduct outreach, and for other DHCS approved uses. Something that's really important about cited is that these funds are for contracted providers. So right now, most of you are providers that are uncontracted. So this means that you would not just be able to apply for these funds and just use them in your current capacity. You would have to be working towards securing that contract or already contracted with an MCP. So what's really cool is that DHCS understands that some of those funds are needed now, just like we said, upfront funds. So what you can do is when you are navigating this contracting process and you're going through gap filling, you can work with your managed care plan. Of course, you have to be a serious provider that is navigating this process and you're working with the MCP, you're fulfilling all of their requirements. You can work with your MCP to receive an attestation that says you are working towards fulfilling that contract. You're like working towards negotiations, you're fulfilling your gap filling, so on and so forth. If you can receive that attestation, you can apply for cited funds to receive those upfront funds to help you with building that capacity. So that's really important to know. Once again, just to reiterate, this is not for, organizations that are just operating in their, current capacity outside of CalAIM. But once you want to start working towards contracting and you're moving to complete that contract, you can apply for those funds to help you with, building up that capacity. So that's just one area of funding that's currently available. The next 2 are also very important. So if we go back to the last slide, sorry about that, Shiv, I'll stay on this slide for just a little bit longer. So the next thing I wanted to talk to you about was the collaborative planning. So we understand that in addition to the TA that you're receiving today, CalAIM is a multi-year initiative. You're going to have questions not just about contracting, but what about when you get into implementation? What about challenges you may experience, any hurdles that you may want to overcome? DHCS is having the foresight now to understand that providers are going to need support. So they have funded collaborative planning groups. If you click on the link that we've included in the slide deck, you can click on that to submit a registration for your organization to participate in a collaborative planning group. These are going to be work groups. And what these work groups are going to do is these are planning groups to address CalAIM implementation challenges and how to use funding initiatives to, solve those problems and improve outcomes, amongst not only the providers, but their patient populations as well. So on the back end, You have your cited funds to help you build up that capacity. On the front end, you're going to have those collaborative planning groups that you can participate in to share exactly what you're going through and receive the support that you need as a group to work through those challenges. And then lastly, another very important initiative is the TA Marketplace. So this is going to be a location where all you have to do is go online to the DHCS website, click on the TA Marketplace, and a list of TA providers, such as ourselves, will pop up. And you'll be able to say, hey, I need help with this. I need help with this. And it'll let you know exactly which organizations that you can go to receive that support. Some of those services are going to be one-on-one customizable support that you would be able to receive with an entity such as ourselves, or some of the services are going to be downloadable content that you can just download to help walk you through exactly what area, your area of support is. In either instance, this is something that is going to be associated with a cost. However, you'll be able to leverage those funds to secure support from that TA Marketplace. So once again, being very forward thinking about the resources that CBOs will need to make sure they can successfully implement CalAIM services. And then lastly, which I'm not going to go in depth on, is the Justice Involved initiatives. And you'll just be able to click on the link that's in this slide if you want to learn more specifically about that. And then lastly, before we go into our Q&A for funding opportunities, I just wanted to go over the next slide, which is our funding map. Essentially, what we want to do right here is let you know what this looks like in practice. So if you see on the center left of the screen, there's a burgundy circle that says LOI and certification application. After you submit that application, you're going to go up and receive your gap filling plan. After you receive that gap filling plan, you can start to leverage those PATH and IPP funds to move you forward to the contracting process and then move you down into implementation. Essentially, we wanted to just give you a visualizer of what this actually looks like in practice and how you can use those funds to navigate that process. And if we go to the next slide, our key takeaways from this funding section are that there are two major should we go to the next slide? Sorry about that. There are two major funding initiatives, which are PATH and IPP, billions of dollars that DHCS has to make sure that CalAIM is going to be a very successful program and to make sure that community support services and ECM providers can receive the support that they need to build capacity to render those services. Number two, IPP funds are paid directly to the MCP to promote CalAIM participation. Remember, the plan does not have to participate in CalAIM. They're being incentivized. And remember that the plans that do participate, it's because they want to see those equity-driven goals actualized. They want to see those equity outcomes. They want to see those CBOs participating in this process. And those funds can be used to support the certification application. Just like I mentioned, the next round is going to be available in Q1 of 2023. You'll work directly with the plan to be able to see how you can secure those funds. And then lastly, cited funds are part of the PATH program. Those are paid directly to you, the provider, and those can be used for you to build the capacity in workforce, IT infrastructure, and more. The next application window for that is going to open up in December, and we've already included that link in the slide deck as well for you to make sure that you have easy access to those funding opportunities. And so before we go into claims and billing and referrals, we wanted to pause for another Q&A to see if anyone had questions about IPP or PATH.
I have a question.
Yeah, thank you.
So let's see. This may sound like a dumb question, but I just want to clarify if we've already received IPP funds. I don't know off the top of my head if that's kind of like a one and done sort of thing, or if it continues, if it's annual. I don't know, or if we have to reapply.
Ooh, so actually, this is a really good question, because it is my understanding that you will have to reapply, but that is not one and done, meaning that if you submit an application because a new round of funds has become available, you can submit an application so that way you can try to secure some of those funds. But what I'm going to do is triple check just to make sure that information is correct, but I am pretty confident that that is the case.
Okay, thank you. And I don't know if we can also confirm if so we can, in other words, reapply during the first quarter again for
Exactly.
the IPP funds, and whenever it becomes available to reapply, pretty much.
Precisely. And so, like I said, I do have to triple check, but I am confident that it is not a one and done, and that you can reapply as those application cycles open, because there's a considerable amount of money, right? And DHCS has made it clear that they realize that those CBOs are going to need ongoing, continuing support. But what I'll do is I'll actually find the exact language, and I'll make sure that I either drop it in the chat or send it out to everyone when we send out our post-event email.
Thank you so much, Alexis. And the same would go for the pet cited. Is that the same thing, or is that continuous?
So those are two different things. So you're 1000% right. So you can braid and blend those funds. So both of those are going to have multiple application cycles. And if you receive one, that does not exclude you from receiving the other. And then I also wanted to back up as well, just to say, in CalAIM, there are no dumb questions. This is a lot, and we understand that it's a lot, and that's exactly why we're here, because we want to make sure that we are minimizing the burden for you to process information by demystifying and putting everything in one place for you that is just really easy to follow and track.
Thank you so much, Alexis. Just really quick, with the PAT cited, is that also going to be a continuous thing where we can reapply for it, or is that throughout the 5 years?
So I'm going to have my same response as I did with IPP. I assume that is continuous, because I've absorbed a lot of funding information. And so I just want to triple confirm, but I'm sure that it's continuous. Whenever that application cycle opens, I'm pretty confident that you would be able to apply for those funds.
Thank you for the clarification. Very much appreciated. Thank you.
Oh, no problem. And like I said, I'll make sure that I actually find the exact language and get it out to everyone, because if you had that question and I did not know like immediately off the top of my head, I know that other people are going to have the same question as well. All right. And did we have any other questions pertaining to IPP or PATH? I know that we have to get to our claims, billing, and referrals section, but we just still wanted to make sure we were saving space for everyone to ask questions. All right, well, we can keep this train rolling, and we really appreciate the questions that have come in thus far. So if we move to the next slide, we are going to discuss community supports, claims, and billing. And so if we go to the next slide, I just want to do a very brief content recap to explain where claims and billing fits into like all of this TA. So during the first session, for those that did not attend, we were able to discuss the MPI process, the LOIs, the certification, contracting pathways, meaning that you can contract directly with a plan or you can contract with another provider such as a county agency. But most specifically, we were discussing the standard terms and conditions in detail. There was no way we would be able to do that again today because of just how much time it takes to go over those standard terms and conditions. So there are really 4 prongs to the STCs that you want to pay attention to. During the first session, we discussed service delivery, quality and oversight, and data sharing. So we really went into depth on all 3 of those. And we've included a link in this document so that way you can just click right there on the slide to access that content so you can have it readily available for you whenever you need it. But for today's session, we've talked about the certification, contract and important documents, impact data from community supports. But as a continuation of those standard terms and conditions, we're also going to talk about claims and billing. So this is how it all ties in together, because claims and billing, these payment considerations, is the 4th prong of those STCs that you'll need to consider. So what we're going to discuss right now are invoicing requirements, the file formats, the transmission methods, the minimum data elements, and the HCPCS. And then for session 3, which we'll talk about later, we're going to tie all of this content together for you from session 1 and session 2 into a series of very specific best practices that you can use to navigate this contracting process. It's really going to be a guide of best practices to make sure that you can get through this process as smoothly as possible. So if we go to the next slide, for community supports, claims, and billing, the providers are expected to submit claims that are in compliance with national standards to the greatest extent possible. That part is really important because DHCS understands that not all providers are going to have the systems in place to be able to submit claims. So if you cannot do that, that does not disqualify you from being able to provide community supports services. Instead, you will be able to submit an invoice that includes the minimum necessary data elements as designed or defined by DHCS. What those elements are, I will go over in just a moment. So you will be able to submit invoices, and we'll talk about the format and how you can get those invoices over. So MCPs shall pay 90% of all clean claims and invoices within 30 days of receipt, and 99% of all claims and invoices within 90 days of receipt. Yes, so 90% within 30 days and 99% within 90 days. So just making sure that you understand the types of or how you can submit those claims. So it can be a claim or it can be an invoice. And, once it is submitted, if it's clean, it will get paid within 30 to 90 days. And then moving on to the format, you can submit an invoice as an Excel-based workbook, as a web-based form, or through a portal. And the MCP actually has to allow you to be able to use any of these invoicing formats. So you have those three options. And so for the invoices as well, the MCP has to have a process that's in place that will allow you to submit multiple services rendered in a single day for a single provider, for a single member, meaning that you will be able to reduce that administrative burden because the MCP will have a process for you to submit multiple invoices concurrently for multiple services for the same member. All right, so we have touched base on the providers being able to submit claims, the formats that you can submit. Sorry, Shivan, if we go to the next slide, we've touched base on the format of those invoices. And then next, we also wanted to touch base on how you submit those invoices. So if we go to the next slide and we talk about the transmission methods, you can use a web-based portal, which is what the MCPs prefer for protection and safety. You can use a file transfer protocol upload, which is what you would discuss with the plan, what that protocol is, or you can use a secure email to send that invoice over. So what I really want everyone to take away from this is that you have options. There is not a one size fits all way to be able to get paid, right? And to be able to submit these claims and invoices, you do have numerous options that are available. And so what's important to point out about the invoice transmission method is that the plans do not prefer secure email because it's the least safe way to do it. And you do have to be HIPAA compliant to make sure that you are protecting the patient's health, the protected health information. And so I just want to recap that one more time. You can submit claims or invoices. You can use a workbook, a web-based form, or a portal. And then lastly, you can submit that via a portal, via a secure upload, or via a secure email. And as I mentioned earlier, every invoice has to have the minimum data elements. So if we go to the next slide, let's just review what a few of those elements are. So it's stuff like the residential address, the date of birth, the member's name, the MRN, the dates of the service, the procedure code, I'll get into that in just a second, and the modifiers, the invoice amount, the service charge, so on and so forth. So when we were discussing the important documents, one of the things that I mentioned was the billing and invoicing guide. So this guide is linked in this slide deck. It's also linked at the bottom of this slide specifically, so that way you can have really easy access to seeing exactly what your invoices need to include on them. And if we go to slide 50 for the HCPCS codes, and the next slide, perfect, thank you so much. And so if we go here, as a part of the minimum data elements, it also said that you needed to list the procedure code. So in that, in the other document that I referenced earlier, the HCPCS document is a very brief document that just has a list of codes. It's very straightforward. When you're entering those minimum data elements onto your invoices, they're going to ask you for a HCPCS code and a modifier. So we have an example right here. So for example, for someone that provides medically tailored meals, you see that your code is S9977, and then there's a modifier that says U6. So it'll literally just break down exactly what service was rendered under that community support. The reason why I'm making sure that you include those codes on your invoices is, number one, to make sure that you get paid, but then number two, to make sure that the MCP can report back to the state what services are being rendered, because that data collection is going to be incredibly important, not only for, future funding opportunities, but to also make sure that the services that are needed are being provided and to be able to track which services are being utilized the most. That's incredibly important. So when entering those minimum data elements, we're thinking about, on the back end, making sure that the providers are getting paid, but on the front end, making sure the providers are getting paid, but on the back end, understanding that DHCS is going to use this information to render incredibly important reports that will impact all of us, because it'll impact, services and the creation of new services, so on and so forth. All right, before we go into our final Q&A, I also wanted to go over some bonus material because we did receive questions from participants about the referrals process. So if we go to the next slide, I just wanted to do an overview of the referrals process. And I only have the process for Anthem here presently because I tried to work and get this for you really fast because we got those questions. But I will also make sure I get the process for HealthNet to get that over to everyone as well. So for the referrals process, Anthem takes a no wrong door approach to receiving referrals. So in a comparable way to what I was just explaining about the billing and claims process and submitting invoices, there are multiple ways that you can submit those as long as they abide by those options and include those minimum data elements. It's another approach for you to consider that with the referrals process, there are multiple doorways that, referrals can be received. So referral sources include member self-referrals, ECM provider referrals, and community supports provider referrals, in addition to other sources of referrals. So the plan will receive that referral will be submitted or received via their Care Central portal, or via email, or via fax, or via the customer care phone number. Once again, multiple pathways here. And then the turnaround time for that referral will be 5 days for a standard referral if it has the correct supporting documentation. I'll go through exactly what that supporting documentation is. But if it's an urgent referral, it'll be turned around within 3 days. Something to be very clear about when submitting those referrals is to make sure that you do not have inadequate documentation. If the plan is unable to reach the member, that could delay the process. So you need to make sure you have the correct contact information. And if they're unable to receive consent from the member to receive those services, that would also be a delay. And then lastly, regarding authorizations, the MCP will authorize services once all of the criteria have been met, i.e., all of that supporting documentation has been received and that member has been matched to a provider. And then they'll provide you with notification regarding that authorization. So just to quickly recap, you have multiple referral sources. They can be submitted across multiple mediums. So the portal, email, fax, phone. The turnaround time is approximately 3 to 5 days, 3 for urgent, 5 standard. There are, delays that you need to be considerate of when, submitting that information to make sure that you have the correct documentation and phone numbers and contact information. And then lastly, the authorization, you'll be contacted once that authorization is rendered. And so going back to that supporting documentation that I was mentioning that needs to be attached.
And so I'm going to take over for Alexis for now until she is able to hop back in. But basically what we are trying to share here is that these are some of the referral supporting documentation that will be requested. And so that can include housing transition and navigation, housing tenancy and sustaining, so this housing support plans and lease agreements, housing deposits, which can include housing support plans, lease agreements, utility bill deposit agreements, and financial statements. Additional items could be short-term post-hospitalization, recuperative care, and respite services. So those are outlined here, and this will all be provided back to you, but you can also go into the DHCS CalAIM data guidance and billing and invoicing links and other documents that we've shared. You can go to the next slide, Shiva. And then these are also additional items. So you can refer to this as somewhat of a checklist. So if you're looking at day habilitation programs, then that would include documentation of housing status by service providers, primary care providers, specialists, or outreach providers, documentation and participation in housing transition and navigation, or housing tenancy and sustaining services. If you are doing community transition services or NF transition to a home, and that can include skilled nursing discharge plans, paperwork, documentation from support agencies indicating services, support members needs or receipts, and then medication or treatment orders. So next slide. And then this is just more additional information. So if you're working on environmental accessibility adoptions, you would provide order from the member's current primary care physician or other health professional specifying the requested equipment, such as physical therapy or durable medical equipment evaluation documenting safety needs, documentation and office visit notes with diagnosis and identification of frailty.
Hey, Melissa, can you hear me?
Yeah, Alexis, I can.
Hey everyone, I'm so incredibly sorry about that. I was kicked out of the meeting. Melissa, thank you so much for going over the supporting documentation. And I think it might be, you can totally let me know. Would you like to go over the key takeaways and launch those two final polls? Or I can do it either, is totally fine, whichever is most convenient.
Yeah, you can go ahead and take over and I can launch the polls.
Perfect. Thank you so much. So I still don't have access to viewing the polls, so y'all can just let me know like how to progress after they're launched. So yes, everyone, sorry again, for that technical difficulty. Like I said previously at the top of this call, we live in the age of tech issues. So just to recap, like what we were just covering for this final Q&A, we wanted to go over community supports, claims, and billing and the referrals process. So we have 5 key takeaways from this specific section. So number 1, community supports providers can submit claims to the extent possible, but you can also completely submit invoices that includes the minimum data elements and those HCPCS codes. And we listed when we hyperlinked the documents that you would need to be able to access and the documents that you would need to know what those minimum data elements are. Invoices can take the form of a spreadsheet, an online form, or a portal, and they can be submitted via a portal, a secure file transfer, or those can be received from a number of sources, and they'll be processed within 5 days, so long as you provide the supporting documentation that Melissa just covered. The MCP will authorize services once all of that criteria is met, and you can expect to get paid within 30 days of receipt for 90% of those claims, and 99% of those claims will get paid within 90 days of receipt. And so before we go into our final Q&A, we just wanted to launch 2 last final polls because we just want to make sure that this content is actually tailored to exactly what your needs are. So poll number 4 is going to ask which of these key takeaways was most helpful for you, because that's how we'll know, like, how we can support other counties, what landed with you, what your needs really are, so on and so forth. And so the first is going to be the important documents that we covered. We have the certification process, funding opportunity, claims and billing, and the referrals process. So go ahead and we'll just make sure that we, oh, there we go. We have 100%. Okay. So, we have 35% that have participated. All right, and if we can just get a few more of those responses, we're at 41%. Let's try to get to 50% so we can have some really good data to keep building these sessions off of. All right, that is wonderful. Thank you so much. So we see that we have some really good feedback on the certification process and the referrals process. That is really good for us to hear. And then we're just going to launch this very last poll that asks, based on what you learned from today's session, how likely are you to pursue a contract to become a community supports provider for a managed care plan in your service area? Is there no change in the likeliness of you doing this? Is it more likely or is it less likely? And yeah, we would just love to know exactly how you're feeling after you've received all of this information. Oh, this is wonderful. All right, so we have about 35% that have participated. If we can get a couple more responses, that would be super great. All right, perfect. Thank y'all so much. So we're going to move into our final Q&A and some very important next steps just to make sure everyone understands what resources they have available to them. So regarding this final Q&A, we just wanted to ask, does anyone have questions about claims and billing, invoicing requirements, the file format, transmission methods, minimum data elements, HCPCS, or referrals? And we do have our plan partner on the line right now. So if you have any questions, we can, just try to answer them, while we have you all here. And aside from those claims and billing questions, did anyone have any other questions related to any of the content? It's totally fine if you wanted to back up a moment to ask anything about the contracting process, funding opportunities, so on and so forth.
I have a question about contracting.
Yeah, definitely.
So currently we're only a CS provider, but I was curious because when we went to a meet and greet, we met providers who were both ECM and CS. Should, let's say we want to look into becoming also ECM providers, how would we go about that?
So, that is a really good question because our TA is specific to community supports. So what I would like to do is just put you directly in contact with the plan. So that way they would be able to direct you to the ECM trainings that they have available and any TA that is specific to ECM. So that way, in the same way that we just walked through the CS process, someone would be able to guide you through the ECM process because there are differences in those application processes.
Thank you so much.
Oh, no problem. And I think that there was a chat from Brandy, but I am on phone, so I can't completely see it. Melissa, did you see that? Please reach out to Anthem.
Sorry. Yeah, I was muted. Yeah, please reach out to Anthem, and then Brandy did include her email here.
Thank you so much, Brandy. We really appreciate that. And I do see that we are at time. It is 3:29, but before we actually go into our next steps, did anyone have any other last questions before we just walk you through what you can do next? All right. Oh, thank you so much, Valerie. We appreciate it. And so that is a part of the next steps, is just letting you know that in this deck, and we'll also send it out via email, there's going to be an additional needs survey. As Valerie just referenced in the chat, we are going to have a third session in just a few weeks. Oh my God, it's right around the corner. And we're going to go over contracting best practices to really tie all of this information together into a guide that's going to get you to contracting readiness. So you can go ahead and click on the links inside of this deck to get registered for that upcoming session, for you to also complete the additional needs survey. So that way we can know exactly what your needs are for upcoming sessions. It's a 4-question survey, super quick. And we've also included the links for 3 funding opportunities. So number 1, for you to apply for cited funds in December. Number 2, for you to have the link to the TA marketplace that's going to be launching in January, so you can have continued technical assistance. And number 3, we included the link for you to register for the roundtable collaboratives. Yes, we have given you all homework because this is so relevant, so important to make sure that you have all of the resources that you need to be successful. And Shiva, if we are able to quickly go through the next slides, on slide number 61, I just wanted to give everyone a reminder that that session is going to take place on December 7th. We're going to send out a post-event email just to let everyone know. exactly how to get registered for that session. And just as a reminder on slide 62, all of the presentation resources can be accessed on healthbegins.org/CalAIM. And we just want to give a very brief but very important thank you to our project partners, Brandy, who was on the call with us today, and also Leslie from HealthMed, who was also just equally supportive and just, really being a champion of the CBOs to make sure that you can navigate this process. And then I would also like to give just a huge shout out to our HealthBegins project team, our project partners at Transform Health, Aurrera Health, and Mount Auburn. And if anyone has any questions, please feel more than free to email us. Our email address is at the bottom of the slide deck, which is calaim@healthbegins.org. And we're looking forward to seeing you all at our upcoming sessions. Oh, thank you so much, Brandy. We'll see you next time. All right, everyone. Thank you all so much.
Thank you so much.